For implants to be successful, they need to be completely surrounded in bone. Unfortunately, in some patients, they don't have enough bone to house the implant, um, whether it's due to anatomic variation, destruction through disease processes, or simply just missing the tooth for a long time. In those situations, we have to perform a ridge augmentation to grow new bone to then allow us to go back to place an implant. The technology, materials, and surgical techniques that are employed in ridge augmentations are far more advanced now than they ever were before. The biggest diagnostic advancement is the utilization of a CBCT. This 3D imaging allows me to better understand a patient's anatomy before the surgery and allows me to perform or come up with a better treatment plan to help them achieve their goals of dental implant. We also have better grafting materials that are also enhanced with platelet products. These graft materials are far more biocompatible than what we had in the past and allows us to grow more bone much more predictably. So I would say overall, the advancements in technology and biomaterials that we have available really makes the treatments cleaner, simpler, and more predictable. A ridge augmentation requires extensive tissue manipulation to achieve a successful result. And this does lead to a fair amount of postoperative inflammation. What I typically tell my patients is that they should anticipate an increase in swelling and discomfort over the course of the first 3 days. It'll plateau for a day or two and then steadily get better after that. After the first week, you should feel about 70% better. After the second week, you should feel about somewhere between 85 to 90% better. At every consultation prior to surgery, we will thoroughly review the patient's medical history, see what medications they've taken in the past to come up with a comprehensive pain regimen for them after the surgery. Most commonly for most of our patients, after surgery, to keep them as comfortable as possible, we like them to stay on a standing course of pain medication, meaning we want you to take medication around the clock rather than as needed. And that's because if you're taking the medication as needed, you're going through this roller coaster of feeling comfortable and then having pain, comfortable and having pain. And we don't want that. We want nice, steady pain control that'll keep you much more comfortable. So we like our patients typically to take medication every 6 hours for at least the first 3 days. Recently saw a patient for her 6-month follow-up after a ridge augmentation that was very successful. And she was really happy that she did it because now she can restore her teeth with implants. At our initial consultation, however, this patient was really nervous and not very sure if she wanted to proceed. She had previously had a bridge that failed, sought an opinion of a surgeon who told her that she didn't have enough bone for an implant, and therefore she had that bridge remade. And unfortunately, by the time she presented to me, that bridge had failed again, and her dentist told her that there was absolutely no way she could have this bridge remade. So she now faced either trying to get back the bone that she had lost over the years with ridge augmentation, or she would need to have a removable prosthesis. When I went into depth with her about the process of the ridge augmentation and what the recovery was like, and the complexity of the procedure, she was a bit hesitant to proceed with the treatment. And after our consultation, I didn't hear from her for actually a couple months. And then prior to her then returning to her office, and she told me, you know what, doc, a removable prosthesis is just not an option for me, so let's give this a shot. So she had faith in me. We did the surgery, and now I'm really excited to move on to the next part of getting her teeth back. The one misconception about ridge augmentation that I would like to clear up is that although the advances in materials and technology have helped ridge augmentation become much more successful than they were historically, they are still very challenging cases that are not easy by any means. The procedure is very technique sensitive and also requires a compliant patient who follows our instructions afterwards. And quite frankly, cooperative biology that we have no control over to then have a successful outcome for our patients. People think that, oh, in bone grafting, you simply raise a flap, put in bone graft material, sew it up, and then in a few months, magically bone appears. The process is a lot more challenging than that. You have to make sure that you place the bone graft in, stabilize it, have nice passive closure. After the surgery, patients have to be very diligent about a soft diet and hygiene in order to give them the best odds possible of growing new bone.